So on this slide is the fishbone diagram regarding my near-miss bedside medication error topic. We know that fishbone diagrams help identify possible causes of an issue and sort those ideas into useful categories. So in here we have factors such as procedures, equipment, technical, environment, communication, and people. Starting with procedures, order entry that are not computerized, inappropriate monitoring, so the nurses or doctors, whoever leaving that pre-filled syringe, in this example, the case study near the bedside and wasn't monitoring the medication appropriately. Equipment such as medication dispensing is not automated. There are still some facilities that do not depend on technology to dispense medication, but most of the hospitals do. However, again, some facilities, nurses still manually go remove the medication and administer it to the patient. Technical, difficult to use materials or look-alike, sound-alike medication, which is a huge red flag when it comes to near-miss medication errors. Environment, location at the bedside, medication, again, leaving that pre-filled syringe or any other medication near the patient where they could obtain it. Probably they think, oh, I didn't take this medication, and they take it themselves without proper administration and patient education by the nurse. There's also poor health literacy, miscommunication between the provider and the patient, which happens a lot, and people such as nurses working overtime or high workload nurse to patient ratios, which is detrimental in many of these cases because nurses work fast. And although we try to be as safe as possible, it could turn easily on us because we are trying to attend all our patients, yet try to do it in the safest way possible. However, there are medication errors that could occur within that process. According to an article based on medication error analysis of subsequent reports that discuss potential etiologies of medication errors have blamed systemic issues. Others have focused attention on certain groups of patients that may be more vulnerable to medical error than others. Recently, the impact of medical errors on patient family members and healthcare professionals have been emphasized due to its effect on exacerbating burnout, poor work performance, mental health decline, and even suicidality. Though it may be challenging to pinpoint the definite cause of medical error in certain situations, it is important to evaluate strategies that can be used to prevent these adverse events from occurring in the first place. One such method is root cause analysis, which has been previously shown to reduce clinical and surgical error in various specialties by establishing a quality improvement framework. And I'll be discussing the root cause analysis on the next slide.